next two speakers to the stage. So we've got Eve and Jen. You mentioned, you will have heard in that previous session, little glimpse of conversation around net zero. So this session is to talk about the green agenda, sustainability, net zero. Both of our speakers are from just up the road, Manchester University Foundation Trust. So take it away. Looking forward to hearing from you. Thank you.
Hi everyone, so I'm Jen, I'm the Group Sustainability Manager at MFT, and this is my colleague.
And my name is Koutidou. I work in Estates and Facilities for Research and Innovation, but I'm also the Sustainability Lead for Research and Innovation, my department.
Yeah, so I guess when we're asked to contribute to this event, we thought actually the most interesting thing might be for us to just have a conversation about what sustainability looks like from each of our perspectives at such a large hospital trust, which will hopefully complement some of the things that have been talked about today. So do you want to kick off?
Fantastic, yeah, so I'll start off. So Jen, can you explain a bit about the sustainable healthcare landscape in the NHS? So how much of a priority is sustainability in the healthcare system?
Yeah. So at MFT, we've actually had a sustainability manager for probably over 10 years, actually. And I think she would probably say, she's still with us actually, that her role has changed massively. So originally was sort of estatesy type things. I always say sort of bikes, bins and bills and that sort of thing. But actually in autumn 2020, NHS England released quite a really important document to kind of set out the landscape. So this was delivering a net zero NHS. And that really helped shift things up quite a bit. So it was really looking at not just the infrastructure, how do we minimise the sort of negative carbon emissions from how we do healthcare, but actually how can we sort of maximise the positive opportunities we have, including obviously the digital landscape. So there's 10 sort of key themes within that report that's actually mirrored in our green plan itself. So it's starting to look more into areas like digital innovation, the supply chain of which for our trust and across the NHS is something about between sort of 60 to 75% of our carbon emissions, and also about medicines, which has a carbon footprint in itself. The NHS was the first healthcare system in the world to actually announce carbon reduction emissions. So that's for our direct emissions, so things like energy use, waste, our travel, etc., and to be net zero by 2040, and for all of our emissions, including the supply chain, by 2045. So I think that was really bold, actually, of the NHS to do that, and to support that happening in practice. There is quite a big infrastructure of sort of green teams. There's a greener NHS team centrally. There's regional net zero leads. There'll be leadership in each of the integrated care systems and most of the trusts. And all trusts have to have a green plan setting out that strategy. And you will start to see them starting to look more into these more innovative areas out of the estates and facilities world, and actually what are the links to how we deliver care, and that might be cutting sort of total emissions in its entirety, or just making what we do more efficient, so things like the virtual wards and things that was mentioned earlier on. So it's exciting, and the growing community of sustainability professionals, I think, is a really good indicator, and the connectivity across our organisations about how important it is for all of us and across the system. Yeah. So hopefully that gives you a good insight, the bigger picture. How about for yourself then in research and innovation? How has this become a priority and your role come about?
I think I'm very fortunate to have experienced that from day one. I think what the key element to putting sustainability to the forefront was the buy-in, the commitment, the engagement from senior leadership. Because there's inherent links between sustainability and research and innovation. So naturally we're there, to deliver more efficient, more less costly, and more kind of innovative technologies to serve the various populations that we serve. So, and Greater Manchester plays a key role in being a regional centre for research and innovation. So MFT as such supported the development and also the expansion of research and innovation, and it it helps set the standards so that our patients can benefit from innovative technologies in health and care. So in fact, about 5 years ago in 2018, MFT recognised the importance of working collaboratively in research and investing in research technologies. So we set up the Diagnostics and Technology Accelerator, which is one of our massive projects. And we also brought together great minds and great talents to obviously develop the COVID-19 National Diagnostic Research and Evaluation Platform. And the aim of that was to deliver high quality technologies, obviously focusing on diagnostic research and health and care. And, you know, it was discussed earlier by the previous presenters that, you know, we understand the benefits of applying artificial intelligence into health technologies. And obviously we use AI to predict how our patients might respond to innovative treatments, new medication and all that. So it's really, really important as well to see that we are making progress on that. Another element is, and we're really proud of that, and it was recently announced that the National Institute for Health and Care Research has awarded Manchester University Hospitals with £3 million. So that will be available from April next year, and that's going to be obviously focused on clinical research and the development of one of the 14 health research centres across England. So we're really, really proud of that, because that will allow us to then focus on providing innovative solutions to urgent and emergency treatment and care by deploying new technologies, obviously, and supporting our local populations with the diagnosis and the monitoring of diseases like coronary heart diseases and etc. So yeah, there's a lot going on. There's a lot of focus on this.
And I think it would be fair to say from our experience at MFT, we've become much more multidisciplinary about this. So we've got a sustainability team, but actually we're kind of seeing the links between the day-to-day business of research and innovation and other sort of researchers within their sort of training journey and things like that. And actually knowing that sustainability, it's not going to be met, the targets aren't going to be met if we don't work in this sort of collaborative way, right?
Absolutely, yeah. So from your point of view, Jen, what are the most sort of standout sustainability initiatives that are currently taking place across MFT in the broader sense, obviously?
Yeah. So I guess each year my team does an annual sustainability report, so I definitely give that a plug if people want to know the broad spectrum of things going on. But, you know, the task at hand is so big, we need to kind of look at everything. In terms of the crossover with kind of today's work and things, I'd say the sort of medicine's carbon footprint has been, we've made some really nice progress there. I know we've got a really keen respiratory pharmacist at Wythenshawe Hospital who's led a project which is kind of using smart devices on inhalers to make sure, well, to have better monitoring of inhaler adherence. So inhalers have a carbon footprint in themselves, and the metered dose inhalers can be up to 25 times more carbon intensive than the dry powdered ones. Those metered dose ones are when it's really bad. It's not your preventer inhaler. So that's a really sort of good example of the kind of crossover here. So by using that sort of technology, they can sort of advise patients more effectively, so they're sort of managing their health, in control of what's happening, getting data, so they can objectively see how they're using their inhaler effectively.
And that's the key, isn't it? Bespoke treatment.
Yeah, absolutely, yeah. And also I think for the patients themselves to feel a bit more empowered and informed of what they're doing, and to kind of try and eliminate any unnecessary prescribing in the system. And actually, following on from that, we've also done a kind of e-learning module, some training education to support staff more broadly to understand that the impact of the carbon impact of inhalers, and actually just the basics of good inhaler technique to accompany the kind of the more sophisticated elements. We mentioned before about virtual wards, so MFT's got a hospital at home programme, that's what we call it, MFT, and actually there's some really interesting work, us working a bit more closely with the clinicians and the directors managing that programme. We're taking part in an NHS carbon footprinting pilot to actually start to unpick what are all the kind of units of delivering this remote care, patients in their home, in the community, what smart devices are they being given, do they come back, what the carbon footprint of those, how many visits to the patient remotely, to actually assess what is the net gain of having those patients off-site as opposed to in the hospital environment where we know that is the most carbon intensive, heating the buildings, clinicians coming with all their sort of single-use PPE, laundry, food, all the rest of it. So I think that will be a really interesting project to actually understand that a bit more and actually use that to make it even more efficient. Actually, where can we take the carbon out of it? The other major changes you will know, last year we introduced the electronic patient record system to MFT, which was a huge undertaking, right? And we're only, I mean, really, that's only becoming embedded perhaps a year later. We're really sort of getting stuck in with that. So that's also facilitated us being a bit more paper-free, let alone we've still got to make progress in terms of patient letters being completely paperless and things, but just even internally, sort of notes and different systems for staff members to communicate with one another. That's definitely helped. Although I know we've talked about this before, I guess a little bit of a kind of cautionary tale or the reality of some of these digital systems. In practice, actually, some areas we're seeing perhaps the use of that digital technology always sometimes makes it a bit easier to be unsustainable. So, for example, around ordering food, in the reality, patients might move around different wards during their time with us, but actually it's so easy to order things. It's easier to overconsume. Same goes for prescribing and medicines, actually making sure the right things are going to the right patient, the right place. And actually we're kind of seeing spikes of some of those things because the digital platforms make it a bit easier to kind of make sure if it's not here when we think it is, let's just order it again as opposed to tracking it down.
We're still at the very beginning of this project delivery, so identifying these gaps in the process is essential, isn't it?
Absolutely,
to render it even more efficient.
And I think it's not just the technology, it's the people and the experts to sort of look at that in a bit more detail.
Absolutely.
So I was going to come on to a bit of the people with you actually, because I know learning and development has been quite a key bit of what you've been championing in research innovation. So do you want to share a bit about what that's looked like?
Yes, so one of the key strategic objectives that we have within research innovation, and it actually matches the focus area within the DMFT Green Plan, is the workforce leadership and sort of engagement with our staff. So we have been privileged to have been approached earlier this year by the Carbon Literacy Project to pilot a new sort of e-learning, combined e-learning toolkit. And following the very successful, let's say, delivery back in April, this toolkit was launched in June for all of healthcare, so it's available on the NHS Learning Hub at the moment. So it's basically bridging this knowledge gap and being able for us to go back to our staff and identify leaders within these very sort of diverse, very different areas of work, and give them the knowledge, the tools and the power basically to make changes, drive carbon and sustainability projects forward, and mitigation schemes basically. So it's really important for us to be able to rely on our staff, the frontline staff, to actually make the change from within.
Absolutely, and everybody's an expert in their particular area of work.
Definitely,
and it's the peer-to-peer format of carbon literacy is really good, isn't it, for kind of getting people to take a bit more ownership of where that intersects with sustainability and reducing carbon.
And just creating these connections and allowing time and space for people to go back into their day-to-day business and actually identify gaps in the services and how we can render these more efficient, really. Fantastic. fantastic. Jen, I understand that obviously our suppliers and our partners play a key role of us actually delivering the net zero targets that we have. So just to close, what would it be for you? What would you like to see basically them do to support us in this partnership journey?
So I would say maybe in terms of suppliers, the one thing I would love to see is a bit more kind of circular economy thinking. So whether it's digital or other innovations within the healthcare supply chain, it's really sort of building into how they deliver our goods and services to the NHS, return schemes, making it easier, perhaps more rentals and NHS buying things, to really design out waste as much as possible in the NHS. If we are to ultimately reach net zero, we have to not just sort of be tokenistically recycling, it's actually designing that in earlier on. So I think within sort of frameworks and tenders, actually being proactive and sharing how we can all work together to have that circularity in the system, that would probably be my thing.
Yes.
How about yourself?
Yeah, I think as the end user, obviously, within research and innovation, we see when we deliver our clinical trials or even before we get to that stage, there is less agility for us to be able to influence the process of, delivery of supply chain. It's so crucial for us because we are there to deliver our green plan, but, equally we need to rely on our partners to do their bit for both of us to succeed in what we aim to achieve in the next sort of 5, 10, 20 years.
Fabulous.
So, lovely.
I think that's us. I hope that's given you a good insight.
Thank you very much. I would be interested to know, and I don't want to put you on the spot, but you talked about suppliers. Is there any sort of innovative work going on around reducing waste in relation to things like you say about inhalers? And I totally get reduce the use of prescribing, but actually, I take an inhaler, and I'll be honest, I don't take it back to the chemist every time. It goes in the bin, and that's that. And what about the blister packs for tablets and all, there's a lot of waste in people's homes, presumably far more in the hospitals. Do you know if there's any sort of innovation taking place with suppliers or within the hospitals themselves around reducing waste from a recycling perspective?
I mean, one of the success stories in that field is maybe around walking aid reuse and recycling scheme, because you can imagine like a Zimmer frame, crutches, all that sort of stuff, metal items that basically would historically have been sort of given out to patients, and then there wasn't really any mechanism to sort of get them back. They end up in household tips, etc. So actually last year we launched a campaign to kind of create a system whereby patients or family members can return those to site, and our allied health professionals will review them and then kind of distribute them out. So I think those sorts of things are really good because we're also kind of seeing the saving in terms of not buying additional things.
Absolutely.
In terms of the waste inhalers and blister packs and things, is an interesting one because there are some systems and processes in the sort of the community through sort of pharmacies and things like that for individuals. However, the sort of waste regulations for us as a healthcare organisation are much more stringent. Yeah. So I think there is a lot of work among sort of the waste managers in the sector and things to try and create innovations that aren't then we're getting butting up across regulation when it comes to the sort of very strict regulations to manage risk of different types of healthcare waste, making that appropriate for the healthcare setting.
I think it's, from what I'm hearing is, for anyone who's in that space or anyone who knows people who are in that space, there's a real opportunity, it feels like, for people, creative thinkers, innovative thinkers to start thinking about products and services that are going to deliver the NHS net zero aims. And as you say, if you're going to be presented with, in some tenders and things like that, two products that are very similar and kind of match up, if one's got a sort of a sustainability, a green piece that's stronger than another, that's going to be a differentiator. We're going to see that more and more. So absolutely. I don't know, I just wonder if that's a bit of a call really to the market to say, if you're out there and you're doing something creative or thinking about it, there's a potential space. And obviously if you are, speak to these ladies and they'll be able to help. That's really helpful. Can we just thank even Jen in the news as well?